Mamas. My name is Carly and I'm here at beautiful Harborview Park in Everett to talk to you about how to modify a standard yoga class for your prenatal needs. It can be very confusing to figure out what your new body needs. Everything has changed. So step one is when you walk into your yoga class, I want you to talk to your yoga teacher and tell her that you're expecting. Even if you haven't told your best friend yet, it's really important that your yoga teacher knows. So it's incredibly beneficial to do yoga while you're pregnant. Number one, for the connection to your body that will serve you so well through your childbirth and through motherhood, as well as all the physical benefits, the stress reduction, the sense of community that you'll develop in your classes, especially if you're able to find a prenatal class, which is gold if you can find it, but they can be hard to find. So if you're in a standard yoga class, what I want you to consider is that at conception, until 3 to 5 months after you have your baby, your body is full of relaxin, which is exactly as it sounds. It's a hormone that causes all the tissues in your body to relax, so you will be more flexible. So rather than enjoying all that flexibility, I do want you to go to about 75% of your abilities, because if you overstretch your ligaments or stress your joints, it can take a long time for that to heal. And I also want you to listen to your body. Take breaks when you need it. There is no shame in just sitting down and taking a break, taking a child's pose or whatever you need. Make sure you eat right before your yoga class so you don't get lightheaded during class. And speaking of lightheaded, if you get lightheaded when you go from sitting to standing, please inhale on your way up. The rest of the class will be exhaling on the way up, but I want you to inhale as you stand and go nice and slow. And avoid going up and down, up and down, up and down if you can. Any balance poses, I want you to take to the wall. So if your teacher calls out half moon or tree, just take it over to the wall and you should be totally fine. And then when you are lying on your belly or lying on your back, again, listen to your body. Some pregnant women can lie on their bellies or their backs and have no problems whatsoever, but some women are terribly uncomfortable with that pressure on the abdomen and also the pressure on the vena cava, which is a vein that runs along the left side of your spine, which is why pregnant women should sleep on their right side. And again, your body will tell you if it's not enjoying that. You'll get lightheaded, you'll get hot and sweaty. So rather than lying on your back, especially in a pose like Shavasana, instead you can do legs at the wall, you can lie on your right side, just talk to your teacher and you can figure it out together. A consideration is twists. Now, any closed twists are just off limits. I'm sorry. For now, you have to avoid them. It's just too dangerous with the placenta adhering to the uterine wall. If you twist too deeply, it could cause some serious damage there. So if your teacher calls out a pretty standard pose like Marichiasana, which is a closed pose, I just want you to open it up. So instead of like so, you'll just be like so. So any twisting pose can be modified pretty simply that way, or you can simply hold the standard version. So if your teacher calls out twisting chair, just stay in chair, okay? And also back bends are a pose you'll just have to avoid right now. I'm sorry again. So rather than a back bend, just stay in the upright version of whatever that pose is, or just take a little child's pose or downward facing dog. Just take a break for a minute. And I know you want to keep your core strength. It's very important to keep your core strength for your back and everything involved there. But if you are doing any crunching maneuvers, called the Valsalva maneuver, you can actually cause serious damage along the rectus abdominis. So your rectus abdominis is your six-pack muscle here, and there's a connective tissue right through the center. And if you do any crunching maneuvers or overwork your abs while you're pregnant, you can actually cause that to separate, and that's called diastasis recti. And that can be very difficult to repair. So just avoid any crunching maneuvers at this time. So do things like plank or anything where you're holding your core upright. And again, I just want you to consider your self-care. It can be really easy as a mother to set your needs aside and to put your family first, but please remember that taking care of yourself actually serves your family, because when you are feeling balanced, when you're healthy, when you have a good sense of well-being, it is so much easier to meet the needs of your family. So it's not selfish at all to take care of yourself. It actually benefits your entire family. And I hope that I can see you in class sometime, but otherwise stay tuned for a postnatal core video that should be coming up soon. Thank you. Namaste.